Community and public health. The organizational structure, legal, and ethical dimensions, sources of funding, and communication processes within community and public health operations are instrumental in maintaining and managing the overall health of the population. The roles of community and public health in the population. Community health relates to society's ability to maintain and achieve its goals of regulating the health of a community. Public health efforts are crucial to maintaining community health through various contributions that improve the quality of life, extend longevity, and in helping people to lead more productive lives. Public health is also extremely important when it comes to minimizing human suffering and negative health effects. This includes being able to respond to natural emergencies and disasters. There are 10 essential services that public health provides in order to manage community and population health. Public health monitors the overall health of the population, diagnoses and investigates health issues, informs, educates, and empowers the population to increase positive health effects, creates community partnerships, and mobilizes resources and organizations to improve health outcomes. It develops policies and plans to correct, manage, maintain, and improve the quality of health and life, links people to health services and health services to other organizations in order to sustain manageable practices that will improve access, quality, cost, and health. Public health efforts make sure that public and personal health care workers are competent, well-trained, educated, and capable of providing best practices. It evaluates how effective and accessible the quality of health services are to the population, and it conducts research that will allow improvements in health programs. In essence, public health efforts are responsible for ensuring the overall health of communities and the population as a whole. Every community, city, and state have public health officials and organizations that are actively involved in improving community health. This branches out much further to federal organizations that are responsible for the nation's health and the population at large. Without community and public health roles, the population would have increased health inequalities, poor standards of living, decreased access to medical care, early diagnostics, and poor treatment of preventative or infectious diseases. The sanitation and safety of food, water, and products would be non-existent, and organized community efforts to improve health would be drastically reduced. Public health organizational structure. Public health organizations are effective because of how they are structured. Every community, city, and state has public health offices, officials, organizations, facilities, and departments. Local public health organizations reside in medical clinics, hospitals, and other facilities. These smaller offices relay information, reports, and feedback to larger organizations like state health departments. State health departments, in conjunction with federal organizations, maintain public health efforts by working together to use the information supplied to them to implement policies, plans, and programs. These policies improve health on a physical, social, and emotional level. For instance, Albuquerque, New Mexico has 3 main hospital chains: Presbyterian, UNM, and Lovelace. All of these hospitals will have public health departments that regulate standards, quality, and safety within the facility. They are governed by state and federal laws to provide specific information and services to patients. Colleges and university branches will also have public health offices that maintain the health of the campus, students, faculty, and any other employee or contractors. The City of Albuquerque has public health offices that are run through the New Mexico Department of Health, which has services and branches in every county. After that, federal organizations like the U.S. Department of Health and Human Services, U.S. Department of Agriculture, U.S. Environmental Health Protection Agency, and the Centers for Disease Control and Prevention, along with many others, are responsible for the health and well-being of the U.S. population. They work as one chain, each link building onto the next, in order to monitor, maintain, and improve the services provided. Legal and ethical dimensions. Federal and state governments have implemented policies, programs, and strategies in order to manage, maintain, and improve public health. They have an ethical and legal responsibility to provide for the general welfare of the population. However, there comes a point in the public health process that the government must decide to ethically provide for the common good or infringe upon the personal rights of individuals. There are actions that public health organizations could take in order to improve public health services. One of these actions would include a wide dissemination of protected health information. This would increase communication through public health organizations and medical facilities, but would provide very little protection for an individual's personal rights. With this being stated, how do public health officials and organizations morally and ethically serve the greater good of the population while protecting individual rights? The Health Insurance Portability and Accountability Act, or HIPAA, legally safeguards a person's protected health information from being disclosed without their authorization. In regards to public health efforts, HIPAA grants public health authorities and organizations the right to gain access to protected health information in order to maintain the safety and health of the general population. This information does not have to be authorized through the individual whose protected health information is being disclosed. Hospitals, medical facilities, and any other organization that is responsible for maintaining patient privacy is authorized to give this information to public health authorities. In order to protect an individual's rights to privacy and reduce infringement on personal rights, public health organizations and authorities are responsible for maintaining a person's privacy. This information is only to be used to prepare reports, generate information, and in finding ways to use the information to prevent and control diseases, injuries, and disabilities. The information is sent to public health authorities who scrub it, extract vital data, and use only what they require. This must be done in a professional manner. Medical facilities, states, and federal policies have all been implemented to guard specific reporting practices and procedures that are designed to track, gather, and utilize specific information on diseases and infections. Other information will be collected on demographic data, disabilities, and other vital health information that can be used to generate policies and programs to reduce health problems. Funding for public and community health services. Nonprofit organizations like hospitals, medical clinics, or other facilities that aid public health efforts receive funding from federal and state sources. Monetary grants and tax exemptions from both federal and state sources help them sustain business practices. They can also receive funding from private donations from local and state organizations, grants from healthcare suppliers, as well as tax revenue in the form of research and development can generate funding as well. Other community and public health organizations receive funding directly from taxpayer money that is distributed through state and federal budget operations. Federal funding of public health organizations receive funding from national income taxes as well. Communication and community and public health programs. In order for community and public health efforts to be successful, effective communication must be present. After data has been collected, it will be forwarded to the next link in the chain. If there is a lack of communication, hospitals, medical facilities, or other entities that gather public health information and data would be inaccurate, missing, or complete. Metrics can be thrown off in the collection process if it is not standardized, enforced, or followed through with. If this data manages to make it to local or state health departments, as communication is vital when information is relayed, it could sit in an inbox or on a desk somewhere because it has not been communicated through effectively and policy enforcement by management. That information may not make it to its intended target. Without data, policy development would not be effective, as accurate information is needed in order to develop an idea or goal. Communication would then be used to transfer policies down to the pipeline for implementation. Here, communication must be present and is vital for the success of the plan. Managers and leaders are responsible for getting the ball rolling on a policy and keeping it rolling. This means that strong and effective leadership will be needed to manage the operations to make sure policy implementation is a success and goals are being achieved. Managers and leaders must then use communication to actively improve the process by collecting feedback. Feedback is important as it is crucial in determining if policies, plans, programs, and strategies are working in order to improve health promotions or problems. This feedback is then used to further improvement and the process in a continuous cycle, constantly gathering information in order to make the process better. Strategy begins with a concept, an idea. That idea is dependent on the information collected at each stage of the process. Communication is vital if policies are to be strategically implemented to improve how public health efforts are being delivered. Teams on every level must decide the best solutions to the health problem, what resources are needed, what resources are available, and how to innovatively improve community and public health for the population. Why community and public health programs are important. Community and public health programs and organizations provide a valuable service to communities and the national population. Federal and state governments play a vital role when it comes to supporting the general welfare of the population. Due to their efforts, policies, and programs, they have been put in place to increase longevity, improve quality of life, increase access to health care, reduce social inequalities, and improve social, political, and economic opportunities for the population at large. These organizations work as a chain, one link building off the next to strengthen and enforce policies and programs. While there are multiple levels to public health organizational structure, they all build off of the progress and work of the previous link to better improve our nation's healthcare services. Without their combined efforts, the United States would suffer from higher chronic and infectious diseases due to unsafe food and water supplies, contaminated and hazardous working and living environments, and would not be able to properly respond to man-made or natural emergencies or disasters. Public health and community health efforts over the last century have greatly improved the health and welfare of the nation's population. Here is a list of the references I have used in order to compile this PowerPoint and this screencast. I hope you have enjoyed this presentation.